Dear friends, so today we are going to do the third model paper for PSC, Kerala PSC Assistant Dental Surgeon exam. Okay, so let's begin. First one, the lingula gives attachment to, the options are upper middle incisor. Second one, sphenomandibular ligament. Third, temporomandibular ligament, and all of them. Lingula gives attachment to, second option, sphenomandibular ligament. Coming on to the second question, sublingual gland is situated between hyoglossus and genioglossus, hyoglossus and styloglossus, genioglossus and mandible, and geniohyoid and genioglossus. So definitely sublingual gland is situated between mandible and genioglossus. Okay, so option C is the right answer. Coming on to the third question, the nerve that is related to the piriform recess in pharynx. The nerve which is related to piriform recess is internal laryngeal nerve. Okay, there is no confusion, internal laryngeal nerve. So option C is the right answer. Question number 4, hypoglossal nerve supplies all of the following muscle except. Question is except. So hypoglossal nerve supplies palatoglossus, it supplies genioglossus, whether it supplies hyoglossus or styloglossus. The one which is not supplied by hypoglossal nerve is palatoglossus, option A. Rest all the three, genioglossus, hyoglossus and styloglossus, all of them are supplied by hypoglossal nerve. So option A is the right answer. Question number 5, submandibular gland is supplied by lingual artery, facial artery, submandibular artery, or inferior alveolar artery. Okay, so the artery supplying the submandibular gland is option B, facial artery. Question number 6, bilirubin is conjugated with glycine or glutamine or acetyl coenzyme A or glucuronic acid. Bilirubin is conjugated with glucuronic acid, option D. Seventh question, the major sign of hypoventilation. So when you have reduced oxygen supply, hypoventilation, what is the major sign for it? The major sign is increased carbon dioxide level. So is it cyanosis or dyspnea or hypercapnia or hypoxia? Option C. Definitely option C, hypercapnia. Question number 8. Renin is released from the kidney in all of the cases except. Okay, so question is except. Renin is released from the kidney when there is a sympathetic stimulation. Yes, that is true. Whenever there is a sympathetic solution, renin is released. So that is not the answer. Decrease in concentration of sodium ion in the proximal tubule, and next option also is telling the same. Decrease in concentration of the sodium ion in the distal tubule. So which tubule there is whenever there is a reduction in sodium ions in proximal or in distal tubule? Whenever there is a reduction in the distal tubule, there will be a release of renin from kidney. So option B is the answer, because the question here asked is except. Okay, whenever there is fall in BP also, blood pressure also, there will be release of renin from the kidney. So answer is B. Question number 9, the contractile element in a skeletal muscle is present in sarcolemma or sarcoplasm or myofibril or endomysium. It is present in myofibril, option C. Question number 10, the ventricular repolarization in ECG is best seen in which part of the wave? Okay, P wave, Q wave, R wave, or T wave. So repolarization, question is repolarization in ECG. Ventricular repolarization is seen in the last part, okay, T wave. Okay, so T is the answer. 11. Cellular swelling and fatty change are examples of reversible injury or irreversible injury. Cellular swelling and fatty changes are reversible in nature. So reversible injury, option A. Question number 12. Difference in transudate and exudate is that former has got what? Transudate has got low protein or high protein or cloudy appearance or increased specific gravity compared to exudate. Transudate has got low protein content compared to exudate. So option A is the answer. 13th question, the persistence of epithelial cells after wound healing give rise to. Whenever there is a persistence of epithelial cells after wound healing, it will result in a cyst formation. So option A, implantation cyst, B, keloid, C. Wound dehiscence or cicatrization. So answer is a cyst, implantation cyst. Question number 14. Heart failure cells are, what are heart failure cells? Fibrocytes in the myocardium or Ashoge's giant cells, hemosiderin-laden macrophages in alveoli or hypertraumatic myocardial fibers. So heart failure cells are mainly present in the alveoli. So option C, hemosiderin-laden macrophages in the alveoli. Option C is the right answer. Exfoliative cytology is indicated in which condition? Whether it is indicated in option A, heavily keratinized lesions of oral cavity? No. Precancerous lesions of oral cavity, most of the times biopsy is recommended. Cigarette smokers? No. Mass screening of cervical cancer? Yes. Screening. The option is screening. So whenever you recommend screening of a huge population, that is mass screening, you always go for exfoliative cytology. Okay, so option D is the answer. Question number 16. Chloramphenicol can cause staining of the teeth, aplastic anemia, bone marrow suppression at both B and C. So here you should remember, chloramphenicol is a drug which will cause aplastic anemia also. It will cause bone marrow suppression also. So both B and C is the answer. Question number 17. Mechanism of action of quinolone. Quinolone is by inhibiting what? By inhibiting DNA gyrase or by inhibiting bacterial protein synthesis or by inhibiting bacterial cell wall synthesis or inhibiting intake of folic acid. So remember, the drug quinolone is always related to DNA. Okay, DNA gyrase. Okay, so it inhibits DNA gyrase. Option A is the answer. Question number 18. The selective B1 receptor agonist is, so B1 receptor agonist, which drug? Dobutamine or dopamine or ethnolol or salbutamol? Selective B1 receptor agonist is dobutamine. Okay, when you look into the pharmacology, dobutamine is B1 receptor agonist. Question number 19. The drug which is contraindicated in hemophilia. So hemophilia, there is excessive bleeding. So in such condition, which drug you will contraindicate? Aspirin or penicillin, aminoepsilon caproic acid or diphenyl dihydrantoin? So you should always contradict aspirin, okay, because it will increase the bleeding. Question number 20. A common side effect associated with all of the NSAIDs drug is, so yesterday in model paper 2 we had discussed about antihistamine, side effect of antihistamines. So side effect of antihistamine is what? Drowsiness. Okay, so here they are asking what is the side effect of NSAID? Gastric irritation. Option B. Coming on to question number 21. Vitamin C is the coenzyme for the following hydrolysases except. Vitamin C is the coenzyme for peptidyl glycine hydrolysis, dopamine beta hydroxylase, propyl or lysyl hydrolysis or aspartate beta hydrolysis. So vitamin C is the coenzyme for, except is the answer for aspartate beta hydrolysis. Okay, option D. Now coming on to question number 22. Hexokinase is a transferase or reductase or oxidoreductase or oxidase. Hexokinase is a transferase. Okay, option A. 23. Muscle glycogen which cannot contribute to blood glucose due to the absence of which enzyme? So which enzyme is absent for the muscle glycogen to be converted into that of glucose? Okay, blood glucose. So it is actually option D. Glucose 6 phosphatase will be absent here. Okay, so option D is the answer. Question number 24. End product of purine metabolism. Purine metabolism end product is creatinine or uric acid? Uric acid. Definitely uric acid is the end product of purine metabolism. Question number 25. To keep blood pH at 7.4, the HCO3 H2CO3 ratio should be in what level? Okay, so the pH of 7.4, to maintain that, HCO3 H2CO3 ratio should be 20:1. Okay, 20:1. Not 30, not 50, not 1. It is 20:1. Question number 26. The term animalcules to oral microorganism is given by which scientist? Miller or Leeuwenhoek or Robertson or Sokransky? It is given by Leeuwenhoek. Okay, animalcules, the term is given by Leeuwenhoek. Okay, it is given in the first chapter of microbiology. Okay. Now, question number 27. The best sterilization method for a handpiece will be ethylene oxide gas or dry heat or chemical vapor or all of the above. The best method is always to use a gas, ethylene oxide gas. Okay. Question number 28. In initial stages of typhoid, salmonella can be detected in which area? Fecus or urine or blood or all of the above places. Okay, in the initial stages of typhoid, it is only seen in the blood. Okay, option C. Question number 29. All of the following infections may be transmitted by dental instruments except HIV, hepatitis C, B or E. So definitely hepatitis E is not transmitted by dental instruments. So option D. 30. The mechanism by which most fungi cause disease is by exotoxin production or acetylase production or hypersensitivity reaction or coagulase production. Most of the time, the fungus will cause disease by hypersensitivity reaction. Okay, option C is the answer. Question number 31. Which of the following deciduous molar bears the greatest resemblance to a premolar? So, which primary tooth has got resemblance to a permanent premolar? Okay, it is actually deciduous maxillary first molar has got resemblance to premolar. Okay. Question number 32. At what age does the calcification of the primary dentition will begin? So the deciduous dentition calcification begins in utero, that too from the 3rd month of gestation to the 4th month of gestation. It begins at that particular time. So 13 to 16 weeks in utero will be the answer. Question number 33. The shape of the occlusal surface of permanent maxillary first molar will be very easy, rhomboidal shape. Okay, permanent maxillary first molar shape is rhomboidal. Question number 34. Palato-gingival groove is found in which tooth? Maxillary lateral or first premolar or first molar or all of them. Palato-gingival groove is seen in the anterior tooth, that is maxillary lateral incisor. Okay. Question number 35. The most common curvature of the palatal root of the maxillary first molar is? Okay. So, most of the times the curvature of the palatal root is towards the facial side. Okay. Option A is the right answer. Dental lamina is active up to how many years? So, the dental lamina is active up to 5 years. Okay. Question number 36. Option D. Question number 37. Following is derivative of dental lamina. So, can you tell me which is the derivative of dental lamina? Epithelial cell rest of molasses or enamel pearls or cell rest of cere or all of the above. So, dental lamina derivative is cell rest of cere. Option C. Question number 38. Pericymata are the external surface manifestations of enamel rod or incremental lines of Retzius or Nasmyth's membrane or pellicle. Pericymata is actually the external surface manifestation of incremental lines of Retzius. Option B. Question number 39. Which of the following dentinal layers is more mineralized? Whether the peritubular area of the dentine or between two dentinal tubules, that is the intertubular area, or the dentinal tubule itself, or the circumpulpal dentine area. So the most commonly mineralized area is the one which is surrounding the dentine, that is peritubular dentine area. Crop fibers are seen in mantle dentine or secondary dentine or reactionary dentine or intertubular dentine. Crop fibers are seen in mantle dentine. Okay, crop fibers are seen in mantle dentine. Question number 41. While preparing a class 2 cavity on a maxillary first molar, which of the pulp horns are likely to get exposed? So, if you don't prepare class 2 cavity properly, which of the two pulp horn is easily to be get exposed? Mesiolingual or mesiobuccal, distolingual and distobuccal, mesiolingual and distobuccal, distolingual and mesiobuccal. So it is confusing, but remember always the mesial side of the pulp horns are very easy to get exposed. So option A, mesiolingual and mesiobuccal pulp horns of the maxillary first molar will get exposed easily if you don't do a class 2 preparation properly. Okay, mesiolingual and mesiobuccal is the answer. Question number 42. Glass ionomer cements are composed of what? Glass ionomer cement contains aluminosilicate powder, but what is the liquid? So that is confusing. Phosphoric acid or polyacrylate liquid? Option is polyacrylate liquid. Okay, so option B. Aluminosilicate powder and polyacrylate liquid is present in GIC. Coming on to 43, least amount of mercury is required in which type of alloy? Admixed alloy or spherical alloy or hybrid type or lathe cut? It is least amount of mercury is required in case of spherical alloy, option B. Question number 44, best marginal integrity is obtained from GIC or gold foil or gold india amalgam. So the best marginal integrity is obtained from a gold foil. Okay, when you use a foil, the margins are most secure. So gold foil. Question number 45. In class 3 composite preparation, retention points should be placed entirely in which area? In the axial wall or in the dentine or at the DEJ or at the expense of the facial and lingual walls. When you prepare a class 3 composite preparation, retention is always given in the dentine. Okay, so entirely in the dentine. Option B is the answer. 46. Two canals are most often seen in which tooth? Okay, two canals are most often seen in maxillary canine or mandibular canine or maxillary lateral incisor or mandibular first premolar. So here, when you look into the options, most of the time two canals are present in mandibular first premolar. Okay, so that is the answer, mandibular first premolar. Question number 47, normal intrapulpal pressure is how much? 10 mm Hg. Okay, so 10 mm Mg. That is a very easy question. Question number 48, difference between physical characteristic of reamer and a file. What is the difference between a reamer and a file? Okay, whether cross-sectionally there is a difference or there is a number of flute difference, or the reamer has got more flutes in the blade, or the files have two superficial grooves to produce flute in double helix design. Okay, so here the major difference in physical appearance is that the number of flutes on the blade are more in which one? Files. Okay, in the files there will be more flute, okay, flutes on the blade than compared to reamer. The files will have more, okay, not the reamer. The files will have more flutes on the blade compared to a reamer. So option B is the answer. Question number 49, Maxpadden compactor is of which shape? Okay, it is a reverse H file. We have learned Maxpadden compactor is a reverse blade of H file. Okay, reverse blade of H file, Maxpadden. Question number 50, the largest component of Gattaparcha cones. So what is the main component of Gattaparcha? Gattaparcha or zinc oxide or resins and waxes or coloring agent. The main component is zinc oxide. Option B. Question number 51, Hutchinson's triad include, so just close your eyes and learn this. Hutchinson's triad include hyperplasia of the incisor, eighth nerve deafness, interstitial keratitis. So all these three come under option C. Okay, in option A they are telling about peclaterals, no. Option B they are talking about fifth nerve, no. It is definitely eighth cranial nerve. So you have option C as the answer. Question number 52, Coxsackie virus causes what? Remember, herpangina. Okay, Coxsackie virus causes herpangina, not infectious mononucleosis, not lymphoma, not herpes. Now, Mickey Mouse ears is a histological feature of candidiasis or paracoccidiomycosis or leptospirosis or tuberculosis. It is a characteristic feature of paracoccidiomycosis. Okay, Mickey Mouse ears. Okay. Now, question number 54, magenta tongue and cracks at the corner of the mouth are seen in the deficiency of, definitely it is seen in the deficiency of riboflavin. Okay, magenta colored tongue and cracks of the corner of the mouth are seen in riboflavin deficiency. Question number 55, oral hairy leukoplakia is seen in AIDS patients. The most likely site of appearance. Oral hairy leukoplakia seen in which area? Mostly in the lateral border of the tongue. Okay, so option A. 56, a major criterion to differentiate between the true angle class 3 and a pseudo angle class 3. So pseudo angle class 3, there will be forward shift of the mandible during closure. So that is how you differentiate between both. So option C is the answer, existence of a forward shift of the mandible during closure. Okay. Question number 57, the minimum anchorage loss can be defined as no movement of the anchor unit, 1/3 extraction space loss, 2/3 extraction space loss, or half extraction space loss. Okay. So it is mainly minimum anchorage loss can be defined as 2/3 extraction space loss. Okay, option C is the answer. Okay, Now, question number 58. Bolton ratio of 87.1 means what? Maxillary tooth material excess or mandibular excess or posterior mandibular excess or posterior maxillary excess. Bolton ratio of 87.1 means maxillary tooth material excess. Question number 59. Bjork placed how many implants in maxilla to study the growth? Around 6 implants. Okay, so 6 is the answer. Question number 60. SNT is seen in which analysis? Tweets analysis or Steiner's or Downs or Ricketts analysis? SNT is seen in Steiner's analysis. Option B is the answer. Now, question number 61. Stimulus response theory. SR theory is also known as, it is a behavior shaping theory. So, option C is the answer. It is not a physical restraint method. It is not aversive conditioning. It is not tender love and care method. It is behavior shaping method. Question number 62. Whistle is a word substitute for explaining the following instrument in children. So, whistle is something which causes a very high sound. So, it is a high speed handpiece. Okay, a word which is used instead of a high speed handpiece. Okay, in pedo department. Question number 63. The most common cause of failure of class 2 restoration in children. Whenever there is a proximal box fracture, there will be class 2 failure. So, option B is the answer. Okay. Question number 64. In Carey's assessment test, okay, which condition does not come in highest risk category? Isolated white spot lesion or enamel hypoplasia or child with a special care need or visible plaque on the anterior teeth. So, when you have a Carey's assessment, enamel hypoplasia is definitely a high risk condition. Child with special care is also high risk condition. Visible plaque on the anterior teeth is also a high risk condition. When you see a single isolated white spot lesion on a tooth, it is not a high risk condition. So the question answer will be A. Option A. Question number 65. A 10-year-old child has intrusion of the permanent maxillary central incisor. The choice of treatment. So the question itself says the tooth has been intruded. Okay, it has gone inside. So what you should do? It's a 10-year-old child. So you can allow the tooth to erupt on its own. Okay, spontaneous eruption will take place. So option B is the answer. There is no need of orthodontic treatment. There is no need to put a splint or anything. It is intruded. So since the child age is just 10 years, it will extrude by itself. Okay, so allow spontaneous eruption. Question number 66. The fundamental particle present in proton is quark. Okay, option C. The fundamental particle present in proton is quark, not boson, not lepton, not neutrino. Question number 67. The skin of a patient undergoing radiotherapy will show after 2 weeks what? So once you undergo radiotherapy, your skin will have reddish color. So it is not depigmentation, it is not radiation induced carcinomas. Definitely there will be erythema. So option A is the answer. 68. Most sensitive phase in cell division to radiation is G1 or G2 or S phase or none of the above. Most sensitive phase is G2 phase. Okay, G2 phase is the most sensitive phase to radiation. Question number 69. Penny test is the quality assurance test to detect fixer depletion or unsafe illumination or machine malfunctioning or contaminated solution. So in radiology, to check the proper illumination, you go for penny test. So unsafe illumination. Question number 70. Grid is used in radiography to reduce KVP or reduce the exposure time, to reduce fogging or none of the above. Grid is used in 80:10 ratio. We saw in model paper 2. It is done to reduce the fogging. Okay, grid is used to reduce the fogging. Question number 71. For a bite wing X-ray, angulation of cone should be, okay, so for a bite wing, the 10 degree above horizontal level. So the focus should be 10 degree above the horizontal level. Question number 72. Identification of gross osseous changes from a lateral aspect can be viewed by which projection? Transcranial or transorbital or transpharyngeal or translaryngel. So gross osseous changes from a lateral aspect can be viewed by transcranial projection. Okay. 73. Salt pepper appearance is seen in intraoral periapical radiograph of which disease? Salt and pepper appearance in thalassemia. Okay, option A. Question number 74. Radiographically sequestrum formed in osteomyelitis is More opaque or same opaque or less opaque? Sequestrum is the dead bone. Okay, it is seen as more blackish in color, so more opaque than healthy bone. Okay. Question number 75. Cup artifact is seen in CBCT or PET or spiral CT or multiplanar CT. Cup artifact is seen in CBCT, option A. Father of health statistics. Okay. Father of epidemiology, John Snow. Father of health statistics, John Grant. Okay. Option B. Father of health statistics, John Grant. Question number 77. Usefulness of a screening test depends upon its sensitivity or specificity or reliability or predictive value. So, usefulness of a screening test depends upon its sensitivity, how sensitive it is. Okay. Prevalence of a disease is rate, ratio, proportion or deviation. Prevalence of a disease is a proportion. Okay, how much? Proportion. 79. Socratic method of communication is used for one-way communication or two-way communication or verbal or formal communication. Socratic method is a two-way method of communication. So, option B. Question number 80. The floating tip of the iceberg represents what the physician sees in the community as clinical cases. Okay, what you see on the top is actually the clinical cases. So, that is the iceberg phenomenon. Okay. Question number 81. One of the following is not a component of psychic structure. Ego, superego, super ID, id. We have three components only in psychic structure. Id, ego and superego. Super ID is not there. Okay, so option C. 82. The electronic probing system Foster-Miller probe detects only the pocket depth, only the CEJ or both the CEJ and pocket depth for Kirschner involvement. So since it is electronic probing method, this method will detect both CEJ and the pocket depth. Okay, option C. Question number 83. The diameter of the tip of a periodontal probe is 0.25, 0.75, 0.51. Okay, the diameter of the tip of a periodontal probe is 0.5 mm. Okay, periodontal probe in the diameter is around 0.5 mm. Question number 84. Root planning is done to remove the cementum that has been altered in contact with an exotoxin or an endotoxin. Okay, whenever there is a contact with an endotoxin, you have to remove the cementum. Okay, root planning has to be done. Question number 85. Which disclosing solution differentiates between mature and newly formed plaque? Iodine or atherosine or two-tone dye solution or mercurochrome? Okay, so the disclosing solution differentiating between mature and the newly formed plaque is two-tone dye solution, option C. Okay, the disclosing solution differentiating between mature and newly formed plaque is two-tone dye solution. Okay, question number 86. The lateral trephination technique is done for impaction of the mandibular third molar or impaction of the maxillary third molar. Okay, lateral trephination technique is done for mandibular third molar, option A. Okay. Question number 87. The following is assessed by the use of KPG index. Canine impaction or cleft palate classification, orthodontic surgery or TMJ analysis. Ankylosis. Okay, KPG index is used for canine impactions. Okay, canine impactions. Question number 88. Carnoy solution is used in the treatment of KOT, AOT, COC, OKC. Okay, just after removal of an odontogenic keratocyst OKC, you have to treat the cyst area with Carnoy solution so that you will prevent the recurrences of the OKC. Okay, so OKC is the answer. Question number 89. The antibiotic cover is mandatory before extraction in the following condition of the heart. Okay, so antibiotic must be given in which condition? In case of a ischemic heart disease or hypertension or congestive cardiac failure or congenital heart failure. If you have a congenital heart failure, definitely you should give an antibiotic coverage. So option D is the answer. Cardwell look incision begins from canine fossa or tuberosity area or zygomatic buttress or above the communication. Okay, Cardwell look incision starts in the canine fossa area. So option A is the answer. Question number 91. Anti-slow provides an aid for selection of pontic, selection of connector, selection of retainer, selection of abutment. Anti-slow provide an aid for selection of abutment. Okay, you select the abutment based on anti-slow. Question number 92. Partial veneer crown is contraindicated in which condition? Partial veneer crown. For having a partial veneer crown, the crown must be long. So it is contraindicated if you have a very short tooth. So option B is the answer. Okay. Question number 93. How much label reduction is needed for a porcelain fused to metal? Okay. So in how much you have to reduce for a porcelain fused metal? For that you need a high amount of reduction. So 1.5 to 2 mm of reduction is required for a label reduction is required for a porcelain fused to metal. Okay. 1.5 to 2 mm is the answer. Question number 94. Provisional restorative material should possess all properties except dimensionally. It must be stable, ease of contouring and polishing must be there, low abrasion resistance, good appearance. So the question is except, okay? Except provisional restorative material must have a dimensional stability, that is correct. Ease of contouring and polishing must be there for that product. Good appearance also should be there. Then it needn't have a abrasion resistance, low abrasion resistance. So except C. C is the answer. Periodontic is ovate, conical, hygienic or modified sanitary. Modified sanitary pontic is periodontic. Okay, option D. Coming on to 96. Distal extension RPD is both tissue and tooth bone or tooth bone itself or class 3 condition or class 4 condition. Distal extension means it is both tissue as well as tooth bone. Option A is the answer. Question number 97. Snowshoe effect indicates what? It indicates broad coverage of physiological basing or indirect retention, all of the above. Okay, snowshoe effect means you should have a very good coverage. So broad coverage. Okay. Question number 98. Lingual bar is a maxillary major connector or direct retainer or indirect retainer or none of the above. Lingual bar is not a maxillary major connector. It is not a direct retainer. It is not an indirect retainer. So none of the above is the answer. Lingual bar is none of the options given above. Question number 99. Strain is defined as an applied load or force, deformation resulting from an applied load, an external force opposing an applied load, an internal force opposing an applied load. So strain is always a deformation. So deformation resulting from an applied load is known as strain. Okay. Last question. The most mucostatic impression material is what? Thin mix of plaster of Paris, zinc oxide eugenol impression, free flowing wax or reversible hydrocolloid. So the most mucostatic material, okay, is thin mix of plaster of Paris. So here we have come to the end of 100 MCQs in Kerala PSC question paper pattern. Okay, so do follow the channel and revise these videos so that it is very easy and quick to learn. Okay, bye bye. Thank you.